Yeah, so in today's class, we are going to discuss about pterygium. What is pterygium? What is the definition of pterygium? Pterygium is a triangular, wing-shaped, fibrovascular overgrowth of the conjunctival tissue encroaching onto the cornea, usually on the nasal side. It is considered a degenerative and hyperplastic condition of the subconjunctival tissue. So just like we can see in this image, it is arising from the nasal side. It is a triangular growth and it is fibrovascular growth, and it is nothing but conjunctiva. So it is a conjunctival overgrowth which has started from the nasal side and is encroaching the cornea. Okay, it is usually because of degenerative and hyperplastic condition of the subconjunctival tissue. Okay, why does this exactly happen? What are the etiology and risk factors? Who are those who will have an increased risk for developing uh, pterygium? That is, the person who are having chronic exposure to ultraviolet light. Okay, now we know why people wear sunglasses. It is not for good looking. Good looking is just an added benefit. Main thing why we should wear sunglasses is to prevent ourselves from developing pterygium whenever we are outdoors. So chronic exposure to ultraviolet radiation will pose an increased risk for developing pterygium. Other than that, dry, hot, windy and dusty environments. So basically farmers are the ones who are at most risk for developing pterygium. Okay, it is also seen more commonly in people who live near equator. So also genetic predisposition is an increased risk factor for development of pterygium. Other than that, chronic eye irritation and inflammation in turn can lead to degeneration of the conjunctival tissue and hence formation of pterygium. Okay, so what is the pathogenesis? What exactly happens? Why does this pterygium develop? So whenever there is UV radiation from the sun, it induces certain damage to the collagen and elastic tissues in the conjunctiva. Degeneration of collagen in the conjunctiva. So whenever this damage happens and the body tries to heal, there will be fibrovascular growth, and this fibrovascular growth will be overgrowth in case of conjunctiva. So this will grow from the conjunctiva and will try to proliferate towards cornea, thereby leading to formation of this pterygium. Okay, so UV radiation induces degeneration of collagen and elastic changes in the conjunctiva, and these changes result in proliferation of fibrovascular tissue from the conjunctiva into the cornea. Okay, so how will the patient present to us? What are the clinical features usually the patients with pterygium have? So it is visibly, it is a fleshy triangular growth on the nasal side of the interpalpebral fissure. Okay, so this is the most common symptom. Maybe unilateral or bilateral depending upon the cause, and symptoms include foreign body sensation, like something is there in the eye which is not mine. So continuous that foreign body sensation, irritation, and because of this redness will be there and dryness will be there. So blurred vision if it encroaches the visual axis. If the pterygium overgrows over the cornea, it is just like covering your mobile camera with your finger, or half of your camera is covered by half of your finger. So what happens? There will be blurred vision. Similarly, if something is covering the cornea, then there will be blurred vision because of encroachment. Okay, so and basically it doesn't look good over your eye, right? So cosmetic concerns are also there. So these are the clinical features of pterygium: eye redness and inflammation, eye irritation, blurred vision caused by corneal distortion, a burning sensation or a gritty sensation or a feeling of itchiness or a foreign body sensation, severe vision problems such as the growth encroaches across your pupil, it can become severe. Okay, and then feeling like there's some foreign object in your eye. These are the clinical features of pterygium. Okay, so there are certain stages of pterygium which you can say based on how far has the pterygium developed from conjunctiva to cornea. So if in stage 1 the conjunctiva is limited to just, I mean the pterygium is limited to just conjunctiva. In stage 2 it has crossed the limbus and invading the cornea, and in stage 3 it will reach the pupillary margin. Okay, so this is cornea and this is pupil, so it is invading. Yeah, it is limited to conjunctiva stage. In mild stage, okay, and moderate stage it is encroaching the, I mean cornea and reaching the pupillary margin, and in grade 4 it will encroach the pupil also. Okay, so these are the stages of pterygium. like trace stage, mild stage, moderate stage, and severe stage based on how far it has developed from conjunctiva to cornea. Okay, so what are the differential diagnosis? What other overgrowth looks like pterygium? So differential diagnosis being pseudopterygium, which may be due to trauma or inflammation, and pingicula. It is nothing but yellowish nodule which is not involving the uh, cornea. Okay, and other differential diagnosis is limbal dermoid. So basically three differential diagnosis: pseudopterygium, then pingicula, and then limbal dermoid. So these are the three main differentiating differential diagnosis for pterygium. Okay, so this is how a pingicula appears. It is just like a yellowish nodule over the conjunctiva, whereas pterygium is a triangular wing shaped structure which arises from the nasal side and will encroach onto the cornea. These are the differential diagnosis. What happens if we don't treat pterygium? It will lead to astigmatism because of corneal distortion. So as we all know, cornea will be having curvatures like this, like it can be vertical curvature or horizontal curvature. So if pterygium happens, there can be a horizontal distortion or a vertical distortion. So based on this, there will be astigmatism. Okay, so visual impairment will be there, blurring of vision will be there, and okay, so these are the complications. And even after surgery, recurrence is the most common complication and is almost like after recurrence, if it happens again, it will be more aggressive. The growth will be faster like this. Okay, so these are the complications of pterygium. How will we manage a case of pterygium? So there are two main possibilities. One is conservative management. Like just like we discussed in the clinical features, there will be dryness of the eye, there will be foreign body sensation, there will be constant itching and irritation. For all those symptomatic relief, we will use lubricating eye drops like carboxymethyl cellulose or CMC eye drops, which are nothing but like artificial tears. So these will try to lubricate the eye and provide symptomatic relief. Okay, other than that, just like I said before, use of sunglasses not only for photos and looks but also for prevention from UV radiation. Other than that, surgically indicated when vision is threatened or for cosmetic purposes or when the patient is symptomatic. So what are the surgical procedures we'll do for pterygium? That is bare sclera excision or just removing the pterygial overgrowth. Okay, that is bare sclera excision. Other than that, we can go for conjunctival autograft, and hence this is preferred because of lower recurrence rates. Also, use of adjunctive therapy like mitomycin C and amniotic membrane graft can be done. So basically, what we will do is we will remove off this pterygium, okay, which is growing, and after removing this, we will have to place that bare area with some graft. So for that, we will use conjunctival autograft or amniotic membrane graft. Okay, and then along with that, we can use adjunctive agents like mitomycin C, which will help in prevention of formation of adhesions. Okay, adhesion formation na idu tapsutte, so adhesion formation will be reduced. Okay, so this is how we will manage a case of pterygium. So for prevention, what can we do? We can use protective eyewear like sunglasses with UV protection, avoidance of direct sun and dust exposure, and early treatment if it occurs. These are the preventive measures. Prognosis, it is good with surgical intervention, but recurrence is common. Recurrence rate can be reduced significantly through autografting and adjuncts. So this was about pterygium.